In addition to directional terminology and the terminology of the body planes, we also need to learn about the terminology that describes body cavities. And when we use this word cavity, we're talking about spaces within the body or compartments that contain and protect and separate out different organs within the body. There are two what we call principal cavities in the body. These are the dorsal and the ventral cavities. So remember, those two terms you could also think of as meaning posterior for dorsal and anterior for ventral. Towards the back of the body for dorsal, towards the front of the body for ventral. So two principal cavities. If you look at the drawing over on the right-hand side of the slide, we're looking at a human who is standing upright and facing to the right. And we are looking at both the dorsal cavity and the ventral cavity of the body. You can also see other cavities in this drawing, and we will talk about those separately. The dorsal body cavity is, like the name suggests, located near the dorsal surface of the body, or the posterior surface of the body. Within the dorsal body cavity, there are two other cavities, the cranial cavity and the vertebral cavity. The cranial cavity is formed by the cranial bones of the skull, and this is the cavity that contains the brain and its membrane coverings. The vertebral cavity is formed by the vertebral column, and of course that is holding the spinal cord and the origins of the spinal nerves that are emerging from the cord. Opposite to the dorsal body cavity is the ventral body cavity, located on the ventral portion of the body. There are two primary divisions in the ventral body cavity, what's called the thoracic cavity and the abdominopelvic cavity. The thoracic cavity is superior and the abdominopelvic cavity is inferior. The thoracic cavity is the cavity that contains the lungs and the heart and all of the associated structures. The abdominopelvic cavity contains the stomach, the liver, the intestines, the pancreas, the kidneys, and the reproductive organs and associated structures. On this slide, we're looking at a human standing upright, facing to the left. So on this slide, we can see both the dorsal cavity and the ventral cavity. If we look at the dorsal cavity first, we can see the cranial cavity and the vertebral cavity. Within the ventral cavity, we have the thoracic cavity and the abdominopelvic cavity. Now, there's a very important structure that separates the thoracic from the abdominopelvic cavities, and that, of course, is the sheet of muscle called the diaphragm. Now, you will hear in different source materials the abdominal cavity described as being separate from the pelvic cavity. And there's nothing wrong with using those terms. The reason that we refer to it, though, as an abdominopelvic cavity is because there is no structure that divides the abdominal from the pelvic. There is no structure like a diaphragm that describes the abdominal cavity from the pelvic cavity. Let's talk for a minute about the structures that are found within the thoracic cavity. The thoracic cavity, or what some people refer to as the chest cavity, remember, is superior to the abdominopelvic cavity, and it's separated from it by that sheet of muscle called the diaphragm. Now, inside the thoracic cavity, there are three separate cavities. There's what's called the pleural cavity, and there are two of them, left and right, the pericardial cavity, and the mediastinum. The pleural cavities on the left and the right are containing one lung each. And there's a small amount of fluid in that cavity as well. So the lung is actually floating, if you will, within the pleural cavity. The pericardial cavity, like the name suggests, is the space that surrounds the heart, and it too contains a small amount of fluid. Finally, there's the mediastinum. The mediastinum is the cavity that lies medial to the lungs. It extends from the sternum to the vertebral column and from the neck down to the diaphragm. Inside the mediastinum, you'll find the heart, the esophagus, the trachea, and several of the large major blood vessels. On this slide, we're looking at drawings of these three cavities within the thoracic cavity. On the upper left, you're looking at the pleural cavity. There's one on the left and there's one on the right. These hold the lungs as well as a small amount of fluid. Over on the right-hand side, you're looking at the pericardial cavity, and of course, this is the cavity that surrounds the heart. And finally, on the bottom, you can see the mediastinum, which, remember, is medial to both of the lungs and runs from the neck down to the diaphragm. And although we don't have a view of it, it also runs from the sternum on the ventral side of the body back to the vertebral column on the dorsal side of the body. On this slide, we're looking at a drawing that combines a lot of what we've talked about so far. We're looking at a human being standing upright and facing us. We can see the cranial cavity and the upper portion of the vertebral cavity. We can see an outline of the abdominopelvic cavity. The diaphragm would be located just superior to that cavity. We can see the rib cage over the right and left lung, so there's a pleural cavity here and another one here. There's a pericardial cavity surrounding the heart and a mediastinum right in the center from the neck down to the diaphragm right here. Now let's think about the structures that are found within the abdominopelvic cavity. So the abdominopelvic cavity is really two separate functional cavities, although there is no structure that divides them. Inside the abdominal cavity, which is the upper part or the superior portion, we find the stomach, the spleen, the gallbladder, the liver, the small intestine, and most of the large intestine. In the pelvic cavity, which is inferior, we find the urinary bladder, portions of the large intestine again, and the internal parts of the reproductive system. On this slide, we're looking at a human standing upright and facing to the right. Again, we can see several of the structures that we've talked about so far. They've outlined the dorsal cavity, the ventral cavity. Within the dorsal cavity, we can see the cranial cavity and the vertebral cavity. On the ventral cavity, we can see the thoracic cavity, the diaphragm, and then the abdominopelvic cavity, which we could break into abdominal and pelvic. There's one other set of terms related to the abdomen that we should be familiar with, and that's what are referred to as the abdominal quadrants. Now, the reason that we use terms to describe the quadrants of the abdomen is because they can be clinically quite useful. In other words, rather than having a patient just describe abdominal pain, we ask them to describe where in the abdomen the pain is located, because certain organs are located in different quadrants. So when we look at a human standing upright and facing us, we can draw a line vertically through the center of the abdominal cavity and a line horizontally right underneath the rib cage. So with the person facing us, that would make this the right upper quadrant. In the right upper quadrant, quite a bit of the liver is accessible. Next to that then would be the left upper quadrant, and that's where the bulk of the stomach is located. There's the left lower quadrant and the right lower quadrant. On this slide, you can see a couple of drawings, both a human and a canine. And they're showing us on these drawings lots of the terms that we've learned about today. The different planes, the different directional terms. None of the cavities are shown, but I think these drawings are helpful just to put a lot of this information together on one slide. There will be some practice questions in your homework assignment related to this terminology. And again, you'll get lots of practice using these terms in the laboratory section of the course.